Hello, and as always, thank you for watching us here at Palos Heights Community Channel 4. My name is Carol Steffen. I'm camera with Judy Weber. We've been invited into a relatively new business here in Palos, and it's called Soft Landing Recovery. I have to search for that, Soft Landing Recovery. I'll tell you what, if you have an opportunity to go back and go to the Regional, which is our local newspaper, and get the November 2nd Regional, they have a fabulous article about soft landing recovery and the people that run it, their purposes, what their outcome is, where it's located, and all the very, very pertinent information. But it's a fascinating article. I truly couldn't put it down once I started. Maybe because this is such a new topic for me that it just really held my attention. Anyway, let me give you particulars. With Soft Landing Recovery, 11925 South Harlem Avenue in Palos Heights. The number, if you want to reach them, is 708-608-9047. And is that 888 number also valid?
Yes.
Yeah. Or 888-347-7079. There's a website. They have a Facebook. The program director is Sean Burbert. Sitting with me today, much to my delight, thank you, Dr. Abid Nazir, who's the program psychiatrist. So he's really the man to talk about with this program. I'm going to read something that I've asked the doctor just to hold off and give me a second to read it. The numbers are absolutely startling in opioid-related deaths, and that's what we're dealing with, the opiates. It's not a really common name for me for drugs, but it certainly is very common in the United States and in the world. Even the President Trump referenced that it's just a catastrophe what's going on in the world, not just in the United States. The numbers are startling in opioid-related deaths. 64,000 people killed by drug overdoses in 2016. Drug overdose is now reportedly the #1 cause of death in the United States for people under 50 years of age. The police now carry 2 injectable doses of Narcan, which is an opiate antidote. Wow. That's amazing. Let's define opiates, if you will, doctor.
Sure. I mean, opiate, that's a term, it kind of refers to, these are medications that treat pain. Their lineage comes from the opium plant, which you'll find in poppy seed. Right. So it's harvested, and, they've synthesized different components of it to treat pain. I think a commonly known opiate is actually heroin. I mean, heroin is derived from the same family. Or now, which has become a really big problem, are the prescription opiates such as hydrocodone, oxycodone, which people might know, Vicodin or Norco, which are prescribed. And that's really where I think this epidemic has gained a lot of traction, is that when somebody's taking prescription opiates, even if it's prescribed for pain, you can develop a physical tolerance to it, a dependency on it, a withdrawal syndrome. So when you stop using it, you get physically sick. That tends to start escalating somebody's use of it. You need more and more of that medication to get an effect, or to just prevent the withdrawals. And if you cannot get access to prescription opiates for some reason, then oftentimes people graduate onto something even stronger, like IV heroin. So people can use this IV snorting form in various fashions. Sometimes it's just plain old prescription that you're used to, tolerance, and you need more and more to get an effect, and you just use it like a normal medication. But they're all forms of the same, really, condition of opiate dependency.
That's scary. It just is. What's the goal of soft recovery?
So, Soft Landing's kind of model. We are like really a comprehensive addiction treatment center.
Okay.
We're unique in some ways. This model kind of, it integrates a full team of specialists in addiction, so like specialized addiction counselors and therapists. We have various settings of treatment, so we can kind of help with detox part of it, maintenance part of it. We don't just focus on only the initial part of this condition, because this is really a chronic condition. Our goal is that 12 months later, after starting treatment, you have the highest chance of being sober 12 months later and maintaining and learning like tools to keep you sober and to stay free of using opiates ongoing. Traditional models have, it used to be 28-day programs are still out there, they're very common. There's a Surgeon General report from last year kind of highlighting how for this specific condition and disease that intensive outpatient treatment is actually highly effective and more cost-saving than a 28-day model, which you can detox, be there 28 days, however, then you go back into the same environment. Your body is no longer tolerant to this medication, but maybe you don't have the ongoing care, and that becomes a dangerous situation. If you relapse and use, your breathing can slow down. You use maybe the same amount you were used to using before, and it can lead to an overdose, which is really a big reason why we're seeing so many overdose. Not to mention, the various highly potent forms of opiates like fentanyl patches, or fentanyl being cut into the different forms of opiates. So our model really focuses on whether it's detox, intensive outpatient. We're all at one location. So in one clinic, you're going to have nurses. You'll have a pharmacy. So we actually will dispense the medication, which is very important when we're treating opiate dependency, because we can monitor exactly what is being dispensed, and we can check to make sure it's being taken as prescribed. We have physicians on staff both for medical care and psychiatric care both, and we have individual counselors and therapists. So somebody can come into one setting, kind of like if you have cancer, you might want to go to a cancer treatment center, right, where you have all parts of treatment all in one location. It's always been in the past where, that we've started doing medication-assisted treatment, right? So this is medicines to help you get off of the opiates. That used to be done a lot of times, it still is, in an office setting by a doctor prescribing these medicines. Problem is, it's very fragmented care. I mean, you have the doctor prescribing medicine, maybe a different doctor prescribing different medicine. Are they filling and taking as they're supposed to? Are they seeing a therapist, doing other aspects of their care? It was really tough, as the number of doctors writing prescriptions for buprenorphine, which is the main medication now we use to treat opiate dependency, those numbers have risen. However, the opiate death numbers have increased along with it. So it wasn't really working, to be honest. And that's because we realized that we need to have a kind of a high-quality, specialized approach where all the services are in one spot, and it's very integrated. So everybody's in communication with everybody else. All the parts of the treatment team, they're connected. So
there seem to be so many facets of this and of the withdrawal. How difficult. I mean, we've all had sort of cases where they go through a 30-day off-site, on-site recovery. You come out and you're going back to the same neighborhood, you're going back to the same influences, you're going back to the same needs. Maybe your neighbors, maybe your family's using. That's a tough battle. That's just a tough battle.
Yeah, definitely. I mean, if you go back into the same environment with the same triggers, there's a disease process when it comes to addictive disorders. There are changes in brain chemistry. A lot of it has to do with reward pathways in the brain, where there's a neurotransmitter dopamine. It can cause excessive surges in parts of the brain. So that can make it really difficult to hold back and use, have the filter to not use again. I mean, that's an overwhelming urge to use.
Absolutely.
So you're gonna lower your chances of success dramatically. So you can't just remove yourself completely from your life situation. That's the reality of, so the treatment needs to focus on how do you handle being in that situation, right? And that's kind of why intensive individual therapy and kind of ongoing care, as long as a client needs to be here to achieve that confidence that they are able to sustain their sobriety, they can be here as long as they need to do that. I mean, that's a part of the plan. We're looking at the long term, not just the initial intervention of detoxing somebody. But the detox part is what prevents a lot of people from getting the help. They are extremely afraid of that withdrawal syndrome. It is very, very
terrible.
It's terrible.
Yeah.
It really is. So that we can do that at Soft Landing here. We can, right from day one, when they stop using, we want somebody to go into a state of withdrawal, and then we can start the treatment for it medication-wise. We use buprenorphine, which is the most common. People know it as Suboxone. There's a brand name for that when it came out, which is kind of like a replacement opiate without the full opiate effect. So you regain control, stop the withdrawal symptoms, and get onto a maintenance dose. So now you're like in control again, of your symptoms. You don't have withdrawal, and you're on a medicine that's monitored. We make sure that people are responding to treatment. We talk to their other doctors. We make sure that we monitor patients with their drug screen. We make sure that what we're doing is working for them. It's very individualized. Every client has their own treatment kind of path, right? So
they're obviously very much in need. Can they come here on a daily basis?
Yes, you can. So there's various levels of interventions, like intensive outpatient treatment or partial hospitalization programming. That is pretty much like a 5-day-a-week where you come for half a day. You're doing group therapy, seeing the therapist, seeing the doctors, and then you step down to an IOP, intensive outpatient, which may be 3 days a week, half days, and then we go on to like the outpatient ongoing model. And that is not, that is different for everybody. Some people need to come weekly in the beginning, and then they change, we change levels based on where you are in treatment. When you come, it's not just come, get your medicine, leave. I mean, it's come, check in with all the various disciplines of the treatment team. So everybody's kind of working together for that client, which is really, really helps outcomes. I mean, people are kind of viewing this as like, we're all in it together to get you better. And the client feels very supported here because they have a variety of different staff members they get to know pretty well.
How about funding? Is it insurance coverage?
Yeah, soft landing recovery works with most insurances.
Okay, right. No.
Even if somebody doesn't have insurance, I mean, they'll go to great lengths to make sure that they have access to care. Like their motto is nobody should be denied a pathway to recovery because of the inability to afford it. So a lot of times things can be worked out to make it affordable as well. So I don't want that to be a barrier for somebody trying to, get help and to say, well, I don't have insurance. Call and talk with them and see what can be done.
How can someone find out about you and the soft recovery program?
So, I mean, there's various ways to do it. I mean, the best would be to start with is go to the website. If you have internet access, softlandingrecovery.com. And you gave the phone numbers at the start of the interview. There's a Facebook page. That 888 number, I think, is a central intake number. We're really, because, there's several locations. We're here at our latest location here at Palos Heights. It's a beautiful facility. You've taken a tour, which is another kind of distinguishing point because, I mean, sometimes, you want to feel like you just feel better when you're in a very good facility, especially when you're being treated. Like if you go to a doctor's office, you want it to be nice. You don't want it, and that matters. But there's 4 other locations.
I was just going to ask you how many other locations. I know you'd mentioned Naperville.
Naperville is the founding kind of location. Yeah, that's right off the highway, I-88. It's on Bond Street. There's Des Plaines has a location. Lakeview and Highland Park has a location as well. We're opening up Joliet location very soon, and we have plans for an ongoing expansion in various states, including Texas. I think is next on our agenda here. We're opening a location out in College Station, Texas.
How about accessibility? Do you find that you're accessible here? Because you're on Highway 1 Route 83, so the main drag. How about transportation?
Yeah, so I mean, this is we try to choose very kind of locations that are very convenient to get to. Sometimes, in some locations, there even can be like where we have a driver transportation service. If somebody has no transportation, to go and pick up patients to come in for their dosing and their day activities that need to be done that day for the visits. So.
How about jobs? Do you help them find work? I mean, I can't imagine a lot of addicts have insurance. Is that not true?
You'd be surprised. I think this disease kind of transcends maybe what the traditional outlook was that, if somebody has an addictive disorder, they're going to be unemployed. But that's very possible. But this is kind of now transcending boundaries here. So a lot of the clients we have are actually still employed and suffering, or they have insurance and they are on somebody else's plan. I mean, there's very, very different kind of situations. But I do think that getting a job could happen once you know you're sober, you're in the right frame of mind. our counselors are highly specialized in substance abuse, and they're very supportive, and they kind of help the process. Ultimately, our goal is to give you the tools to go and find your job again and get productive again in society. If that's where you're starting from, is a place without employment, then with recovery, hopefully will come, functionality.
Do you deal with family support? How about you bring the family in for the sort of conferences?
Yeah, I mean, families are extremely involved. I mean, we accept referrals to the program from a lot of different, places. Like, it could be a drug court, it could be from, primary care doctors, it could be from high schools or college, guidance counselors, you name it, an individual therapist. So we'll get referrals from a lot of places. A lot of times, though, the families just bring their loved one in, and they're involved in the process. Our therapists are in contact with the families, and there can be actually family, group therapy or involvement, or a family session.
Yeah. Well, you're very important being a psychiatrist. I mean, the support has got to be there. Your counselors here, the support has got to be there.
Yeah, I mean, psychiatry. So addiction is kind of like it's a subset of within the psychiatric field. So ignoring, let's say, somebody has anxiety or depression, that could be contributing dramatically to their what we like to say, self-medicating. Like, they're going to find a substance to cover up the symptoms. So we have psychiatric care here in the visits as well. So we're addressing that at the very same time.
It's just so accessible. All the drugs are just so accessible.
That is true. I mean, that you can. A lot of times we'll even be in a situation where they have prescriptions for maybe a medicine along with, they've been prescribed opiates. Okay, now they're here for treatment for that, but maybe they're on a different medication, like an anxiety medicine that could be addictive on its own. So we're not going to ignore that and just it might be from another doctor, but we'll be in communication with the other providers to make sure that everybody's on the same page. What meds are safe to be used long term? Which ones should we avoid?
Okay.
I mean, we treat opiate dependencies, the epidemic, but we also, we treat alcohol dependency or other addictive disorders like cocaine. But our focus has been opiate, because that's where all the crisis is, and we use buprenorphine, but we also have other possible options like Vivitrol injections, which are monthly injections to block the effects of an opiate. We use that for alcohol dependency as well. We have the traditional method of methadone that's available as well.
Okay.
So everybody's treatment plan kind of is tailored for what would work best for them.
It's really so beneficial that you're in existence, and especially now, and of course you're in existence because of what's going on now. This has been very interesting. I found this whole topic to be amazing because I knew so little about it and didn't realize I knew so little about it, that it was so pervasive.
Yes.
It's just amazing. As I say, I really recommend this November 2nd, regional. Go back, you can go to the regional office and pick up the old copy. It's very complete. I thought they did a really, really nice job of presenting it. Okay, we are talking to Dr. Nazir from Soft Landing Recovery, 119th South Harlem. But let me point out to you, if you're going to come around to the back part. Don't enter off Harlem. Go around to the back street, and because that's where the front door really is. But thank you, Dr. Nazir, for talking with us. It's been so educational for me, and it's opened up a new level that I'm going to look into even further. It's scary. I have grandchildren. I have all sorts of people to be concerned about because all these things are very available.
We thank you for visiting us and kind of helping educate everybody in this community.
We'll be back.
All right.
I promise we'll be back.
Thank you.
And I hope you'll stay with us, and we'll be back with you.